gentlemen, our online distinguished guests and partners, good afternoon. My name is Christine. On behalf of Taipei Computer Association, it's our honor to welcome you to the third edition of International Smart Healthcare Forum, advised by Ministry of Health and Welfare and Taipei City Government, organized by Joint Commission of Taiwan and TCA. International Smart Healthcare Forum is an annual event held concurrently with the Smart Healthcare Expo. This platform provides rich opportunities to demonstrate the latest healthcare technologies, enabling the interchange of pragmatic medical techniques and technological innovation. As a highly interactive event, it offers opportunities to network and to understand how a collaborative approach. The theme of today is Artificial Intelligence, 5G, Transformation in Healthcare. In this 2-hour session, you'll hear about the latest technology innovations from 3 featured speakers for their applied experiences, as well as 2 leading companies for their industry insights. To begin with, we are pleased to invite 2 distinguished guests to give us open remarks. Let's welcome Dr. Chu, Deputy Superintendent from Taipei City Hospital, and also represent Taipei City Government, to give us an opening remark. Let's give a warm welcome to Dr. Chu.
Dear Chairman and distinguished guests, I'm Dr. Chu, Deputy Superintendent of Taipei City Hospital. It is my great honor to represent our Commissioner of Department of Health of Taipei City Government to here at the International Smart Healthcare Forum. Under the impact of pandemic, there are many limits to people and the tremendous economic impacts. Our only smart applications with IoT and e-commerce found their ways out with fast growth. Something like Uber Eat and Panda Eat, and we are taking an important role in economic recovery during this post-pandemic period. Therefore, it is a perfect time to hold this International Smart Healthcare Forum. Congratulations. Taiwan takes good advantage of our smart healthcare technologies, which is one of the major reasons that Taiwan can contain the spreading of the COVID-19 efficiently. At the early stage of this outbreak, our government has responded quickly by deploying boarding quarantine and a web-based QR code system at the airport for less physical contact and easier late travel tracing. We also applied the electronic fences and the GPS positioning system to take care and monitor people in home quarantine. With the high-density internet network that Taipei City Government had invested for smart city infrastructure, we developed the so-called real-name mask selling and rationing machine, 实名制的口罩贩卖机 which integrated with health insurance cards, selling machines, packing, and logistics. This application not only reduced the time and effort for people to purchase masks, but also paved the way for future smart pharmacy and IoT selling. Taipei City Hospital, where I came from, insists on the spirit of humanity caring. Besides the telehealth services approved by central government, we provided even warmer services by greeting the patients before providing home care, including understanding the family's recent history of travel, contact, and the symptoms. With the help of smart healthcare system, our palliative care at home persisted even during the severity of the pandemic. providing comfort and dignity services. We refuse to let the end-of-life patient die alone just because of the pandemic. The technologies, humanity caring, and the smart healthcare services are ready here in Taiwan, helped to respond to the COVID successfully, and has been entrusted by the government and by the people. So in the future, we expect to have more breakthroughs in the smart health care related legislation. Finally, I would like to take this opportunity to express my respect again to whom had been playing years of efforts in the healthcare technology and the medical services. Thank you very much.
Next, let's welcome our organizer, CEO of Joint Commission of Taiwan, Dr. Wang. Let's give a warm welcome to Dr. Wang.
Hello, good afternoon, everybody. Our distinguished guests. It's my greatest pleasure and honor to be here in this very wonderful session. So this is actually the 6 years of the SHE, the Smart Healthcare Exposition. But unfortunately, this year we have the pandemic worldwide. But we are very lucky in Taiwan. We still can have this meeting in June. And we are expecting a grand reopen in the coming weeks. So let me introduce the Joint Commission for everybody. Joint Commission of Taiwan is a national accreditation body that in charge of all the hospital accreditation and postgraduate year education, and also the quality improvement of Taiwan. So people may ask why we are here in this IT occasion. So let me explain to all of you. Because we are in charge of the nationwide quality improvement campaign for more than 20 years. And more, we find we need the help from the IT technology to help us to improve the healthcare quality. So we need to adopt all the new technology into the healthcare so to improve the care quality. So that's why we cooperate with Taipei's Computer Association to sponsor this very wonderful occasion. So today you will see many presenters from the industry and from the hospital to show you the best development of the IT solution in terms of quality improvement in the healthcare. So I hope you will enjoy this session this afternoon. Thank you.
Thank you, Dr. Wang. Dr. Wang, please remain on stage. Now, I would like to invite our speakers for a photo session. Dear speakers, when you hear your name, please step up to the stage for a group photo shoot. Let's welcome Dr. Chu from Taipei City Hospital. Dr. Wayne from Taichung Veterans General Hospital. Dr. Lee from Tree Service General Hospital. Dr. Yan from Mackay Memorial Hospital. Dr. Ted from Guangda Computer. Dr. Ro from Zhonghua Telecom. Okay, everyone look forward. Can point your thumbs up. Thank you. Thank you. Now you may return to your seats, please. Thank you. And now for our first presentation, I would like to welcome Dr. Yang, Center of Biomedical Development from Mackay Memorial Hospital, who will be talking about smart healthcare cross-industry innovation at Mackay Memorial Hospital, the past and the future.
Good evening, everyone. My name is Shen Yan, and I'm honored to be here at the 2020 International Smart Healthcare Forum representing Mackay Memorial Hospital. Today, I will be talking about smart healthcare and how cross-industry innovation at the Mackay Memorial Hospital has shaped the past and will continue to shape in the future. As a brief overview, smart healthcare at Mackay falls under two broad categories. On one hand, we have the hospital portion, which include our outpatient department, wards, etc. On the other hand, we have the community aspect, which includes advancements through breast cancer mammography screening, telemedicine, and home care. Let's begin by diving into smart healthcare in the hospital. In the outpatient department, Mackay has developed an app that can allow patients to check their department a schedule for appointments, blood collection, OPD dispensary, and registration, and even includes a disease reference guide, a traffic guide, and a mobile cashier. On the operation side, we have increased the efficiency by digitizing scheduling, space and equipment allocation, and biopsy specimen tracing. Additionally, we have integrated a QR code into each patient's examination notice, where scanning the QR code will direct the patient to additional educational resources and information related to their situation. In the health evaluation center, patients wear a beacon device that automatically notifies the smart health evaluation system and of their location and progress through their examination procedures. This way, healthcare workers can better manage where each patient is and arrange their examination schedules, which greatly increases efficiency throughout the process. For doctors' morning run, Mackay has also developed an iPad app for doctors to connect to their mobile dashboard. This app allows doctors to directly access patient data, including their medications, ER records, medical reports, and even imaging, which makes it more convenient to doctors to have conversations with patients at the bedside. Within the world, many Bluetooth low-energy devices are also placed that serve as emergency help button, patient safety monitors, and equipment detection sensors. A smart localization system combines Bluetooth low-energy sensors, cameras, and FusionNet IoT gateways to provide medical personnel and security workers with real-time equipment monitoring on a mobile app. When specialized equipment is carried out of their designated areas, an alarm will go off and a recording will be activated. Since AIoT devices have also been directly integrated into the ward, many of these devices can help monitor patients' breathing, blood pressure, and other vital signs, data which can be transmitted into our hospital information system. The data can be then used for big data analysis, where we can develop an algorithm that predicts when hemodialysis patients may have low blood pressure, as well as monitor the status of AV shunts. This type of AIoT system can also be used for automatic detection and monitoring of ventilators, including conditions as ventilator-associated pneumonia. In the emergency room, we developed an intelligence ER app that can help patients with appointment registration, where they can provide their chief complaints and present their illness history, surgical history, travel history, allergy history, tetanus history, etc. All this data is automatically connected to our registration and inspection classification systems, so that as soon as the patient reaches the ER, they can immediately be treated. We have also integrated an intelligent dashboard in the ER, so that patients can be informed about their current waiting status, whether or not they can consume food, and information about their main doctor and nurse. Patients' family can also track the patient's whereabouts throughout the dashboard. The intelligent system can also notify patients about when and where to enter their appointment, which doctor they should see, and help notify and search for family members. We have also installed an intelligent violence alarm system on healthcare workers in the ER. Each worker is equipped with a beacon alarm system. If they encounter potentially violent patients of all family members, medical personnel can immediately sound an alarm to the security guards, who can directly monitor the situation through the security cameras and take appropriate action. Specific to COVID-19, we have recently put up temporary negative pressure isolation wards in the ER, which are equipped with AIoT devices that collect and deliver vital signs data directly into our hospital information system. This system can help medical staff decrease unnecessary visits into the isolation wards. In the operation room, we have digitized the entire anesthetic procedure and all related machines. Through AIoT devices, the data is again transmitted to our hospital information system, which automatically creates anesthetic reports and patient records. All of this pre- and post-surgery anesthetic information has already been digitized and is ready for big data AI analysis. Results help monitor patients during surgery and identify problems that can minimize harm. On the accounting side, in the past, records have been prone to human error, and human verification is also time-intensive. Because of this, we implemented a barcode system where all medical supplies and devices are given a unique barcode for identification, which can simply be scanned by the cashier and entered into the computer system. This greatly decreases the posting entry error rate. On the aspect of endoscopic infection control, we combine our original imaging and report systems with a unique endoscopic barcode. This way, we are able to record each machine's usage, the doctors and patients who uses it, and their sterilization status, which can help track their usage and manage any disease contamination. In the case of an emergency requiring callback, we have mobilized the popular app Line to create an emergency callback system for employees. The hospital can notify employees of emergencies through line groups, immediately gauge availability, and facilitate check-ins once employees arrive at the hospital, all through this digital platform. This increases efficiency and human resources management in times of crisis. At Mackay, we have around 60,000 medical devices in total, which we have all digitized to provide better equipment management, regular maintenance, budget assessment, and enable digital repair applications. We also have included the data of each device's manufacturer for ease of lookup, statistical queries, and use benefit. Now, all of that was how we have implemented the smart healthcare system into hospitals. We will be transitioning into community-based smart healthcare. Community-based medical care is not a new concept. However, there are lots of inefficiencies in the past that can be gradually remedied with new technology. Let's take mammographic screening cards as an example. In the past, the X-ray images from these cards needed to be manually delivered back to hospitals, then interpreted by doctors, and finally the patient is notified to come into the hospital for further examination if there is an issue. However, this process often takes 1 to 2 months, which may be extremely stressful time for the patients. In the future, we plan to developing a system that integrated AI with 5G in these screening cards, which directly sends imaging into hospital using 5G, diagnoses the patients almost immediately using AI, and can notify the patients even while they are still in the car. They can then immediately make an appointment with a hospital for further treatment, which decreases their waiting time and worry time. On the aspect of the telemedicine, we have integrated the necessary equipment, software, and the transmission system, and will be starting a pilot program in conjunction with the public health centers at Shanzhi and Sima Kusi. We hope the development of these telemedicine services can help rural areas gain more access to medical resources, which they are currently lacking. For community and home care, we designed a healthcare app that connects to a healthcare service station in each neighborhood, where patients can come to get their blood pressure taken, weight and cholesterol measurement, etc. The data is then transmitted into our cloud service platform, where patients' real-life health situation can be monitored by professionals. The app also lets patients make appointments, read relevant public health information and education resources, and check results of cancer screening. In the future, we hope to extend this type of service using AIoT fusion sensors, so that patients can collect their own physiological information from home, including blood pressure, heartbeats, exercise, blood sugar, etc. at all times of the day. This data can likewise be uploaded via 5G or a fixed network onto the cloud, where AI algorithm can help us to this data to warn patients and their families of any health anomalies in real time, or directly inform the patient's physician for further observation and treatment. This real-time notification system can decrease the chance of health emergencies, and the data collected can also help the patient's doctor make their diagnosis and treatment decision. To conclude, smart health care for the future can only be achieved with a trifecta of partnership between, first, healthcare providers and medical professionals, second, industry collaborators at the forefront of biotech, which creates innovative medical devices with new functionalities such as AIoT fusion sensors, and third, with data scientists and AI experts who can leverage healthcare data to gain better treatment and analytical insights. We here at Market Memorial Hospital hope to continue expanding our partnerships with experts and organizations from all these domains and provide our medical expertise alongside our digitized database and platform. Together, we can transform the future of smart healthcare. Thank you to all those who are tuning in virtually, especially to our colleagues overseas who could not be here in Taiwan. Today, I hope you leave this talk with new insights about the ways in which market can help. Next time, when we meet, with the combination of Taiwan's goals in cross-industry innovation in smart healthcare, I hope that my future partnering message will be, Market is helping, Taiwan is helping the world. Thank you very much.
Thank you, Dr. Yang, for your presentation. Next, I want to welcome Dr. Lee from Tree Service General Hospital, who will be speaking on healthcare transformation through IT innovation. Let's welcome Dr. Lee.
Good afternoon, everyone. My name is Jiazhen Li. I am the CEO of the IoT Center, Tri-Service General Hospital. My topic today is how to use IT technology, transforming clinical care patterns to improve the quality of healthcare. The term healthcare transformation might sound unfamiliar to some of you. So I will use one example to explain what healthcare transformation is, and then share with you some of our successful experiences about using IT technology to improve the quality of healthcare. And lastly, share our plan about how to scale out our IT healthcare innovations to other hospitals. Tri-Service General Hospital is a medical center located in Taipei City with nearly 2,000 beds. We provide services for not only civilians but also soldiers, which make us distinguished from other medical centers. For many years, we strive to use novel IT technology to continuously provide high quality of healthcare to our patients. If you have a chance to visit our outpatient clinic, you will find out that every patient-related service is integrated with information technology. Our patients can track the waiting time, the progress of exam, or result directly from our app. And these outpatient facilities make medical services more transparent and accessible to patients. And usually, this is the first step to smart hospital. But if we dive deeper, these services basically didn't change or improve patients' outcome. To improve patients' outcome or quality of care, we need to use IT technology at a higher level in diagnosis, treatment, and healthcare process. In other words, to transform the healthcare system with IT technology. And here is one example. We know medication compliance is a problem. Patients may not necessarily follow physician's order to take medicine. This problem happens very often for kids or aged patients. Last year, to improve the medication compliance, we developed an app. This app basically linked to our medication database, so our system will push a message to patient's cell phone to remind he or she it's time to take the pills. And this is a good example to demonstrate that how IT technology can provide personalized healthcare experience to improve the quality of care and maybe outcome. In this case, the interesting thing is that we use computerized physician order entry system for over 25 years. Why apps like this haven't been developed till now? The answer is because until recently, we have good enough communication and IoT devices technology to deliver the medication information more easily. So, the main idea of healthcare transformation is simple. We want to use IT technology to change or transform healthcare patterns so we can improve patients' outcome. To do that, the key is to integrate three things: information, IoT technology, and communication. To provide intelligent healthcare services, digitalized medical information and system integration are two major foundations. Please notice here, for the development of smart hospital, the system integration means not only integrating various medical information systems, but also integrate with IoT devices with appropriate communication methods. The bottom foundation of intelligent healthcare service is to fully digitalize hospital information. A medical center is a huge amount of data. Since last year, we generate 40 million digital signed documents per year. If we print those documents out and pile them up, it's about 7 times the height of the 101 building. And the growth rate of documents is still increasing every year. With such huge amount of digitalized hospital data, the benefits is obvious. We can provide information to our patients or health workers anytime, anywhere, with the way they want to see it. Once data has been digitalized, we rely on different types of IoT devices to deliver information to users. And of course, the collection of some data also rely on IoT devices. In our hospital, right now, we have over 15,000 IoT devices. And we expect the amount of wireless devices will keep increasing. The wireless devices brings efficiency and convenience to users. But the speed, bandwidth of wireless technology so far cannot fully support hospital needs. Of course, recently the 5G and the Wi-Fi 6 might solve some of these problems. For the last 5 years, we successfully integrated medical information, AIoT devices, and communication methods in many medical applications. With the AI and big data technology, these medical applications are widely being used to improve healthcare quality and clinical outcome. One important technology we used is AI. With the AI integration, we can deliver healthcare services in a more smart, active, and efficient way. Starting from 2015, we use AI technology if it fits our workflow. This technology is being used in our hospital, including unstructured data analysis with NLP and waveform imaging data analysis with neural network. The AI Ecg project in our hospital is a good example about how we use AI for automatic data analysis and integration with our clinical workflow. In this project, we only focus on life-threatening diseases with specific ECG findings. We developed a 189 layers convolutional neural network called Ecg 12net for model training. And after the model reached high performance, we integrated the AI module into our hospital workflow. So, after patient receive ECG exam, digital data directly captured and interpreted by our AI module. Critical life-threatening results will send to physicians with our text messaging system. The system is very effective and popular by our physicians, and that's because the AI system can mark and show the abnormal segments to them, showing them why and not just the result. The system works well, especially for the detection of blood potassium level and acute myocardial infarction. And actually, this is the world's first single module can detect high or low potassium level at the same time. The advantage of this system is that we didn't try to compete with human experts or to replace their jobs. Instead, the value of the system is that it provides an early interpretation and warning to the physicians right before they have chance to read the ECG result. The system goes online for almost 2 years in our hospital and prevents several potential life-threatening events. As I mentioned before, a smart healthcare system requires the integration of information, IoT devices, and communication. In recent technology advancement, the 5G implementation can provide novel change in healthcare. Besides its broadband and speed upgrade, two novel characteristics I want to mention here. One is low latency near real-time transmission. This can be helpful in some clinical scenarios. For example, used in remote robotic surgery or surgical consultation. The other one is the vertical services, which provides private 5G network in hospital, so we can have high-speed wireless transmission with controlled security. Since 2 years ago, we worked with ITRI and the industry as a national team for piloting 5G vertical healthcare applications in our hospital. There are several 5G and IoT applications under development right now in our hospital. This is one experiment in our operation room. Surgeons wear mixed reality glasses performing surgery. Through 5G transmission, he can consult distant physicians with high-quality images and near real-time transmission. The surgical scenes can also be wirelessly live broadcast to young surgeons and students for education purpose. Another example here is the smart wound care system, which combines the interpretation of wound condition with AI and directly transmission wound information to physicians for further management. The last thing I want to mention is the COVID-19 outbreak. Our government and healthcare system did very good so far. But as many countries are still with many active cases, we still need to highly alert. So early warning, rapid diagnosis, and effective treatment are important for the next several months. And what's the role of health IT in this topic? Actually, there are many chances for IT to improve the infectious disease monitoring, controlling, and management. Recently, we joined an international project using AI federated learning method for COVID-19 diagnosis and treatment. And this is a good example of collaborative AI module training without exchanging privacy health data. With these types of international multi-hospital collaboration, we can develop health AI system with higher performance than systems developed from single institute or hospital. Our goal right now for our hospital itself is to become an AI-ready hospital. But for the whole military healthcare system, we are working on using cloud technology, deploying our successful IoT services to other 13 hospitals, so they can share the benefits. This is very important because no single hospital or enterprise can afford to develop all healthcare intelligent applications. With the smart medical cloud deliver AI services, we can maximize and scale out our achievement to promote healthcare transformation and provide benefits to our patients. Okay, thanks for listening.
Thank you, Dr. Lee, for your presentation. Our next speaker will be Dr. Wayne from Taichung Federal General Hospital, who will be speaking on leading role of medical center in advancing to digital health. Let's welcome Dr. Wayne.
So good afternoon. It's my great honor to be invited to deliver and share our experience with you. I'm Dr. Wayne Schutz. I'm the superintendent as well as a diabetes doctor of the Taichung Veterans General Hospital. So here's my outline. I will briefly introduce the hospital I came from and then discuss with you the current trend of digital health. So before I make the conclusion, I will spend some time to discuss with you the strategy we use and the implementation we conducted in my hospitals. So Taichung Veterans General Hospital is belong to the Veteran Affairs Council in the Executive Yuan. And we start up our services 1982 in the beginning for veterans only, but nowadays we serve for veterans as well as citizens. So in addition to hospital, we have 3 branch hospital in the central part of Taiwan. We also have 4 veterans houses. So a quite big system, medical system in Taiwan. So this hospital is famous as one of the pioneers in the information technology in Taiwan. We are the first to be so-called frameless hospital. We are also the first to be called the paperless hospitals. Nowadays, we are in charge to unify all the IT system in all the veterans hospital in Taiwan. So back 2 years ago, we are very proud to get award, so-called the National Medical Award, Quality Award. So that's me. I got the honor plaque from our Vice President, Professor Chen. And last year, actually, thanks to all the effort by our team, we again have the award, so-called the Smart Hospital Award, and awarded by the Joint Commission of Taiwan. Actually, it's not an easy job. I will share my experience to all of you. So in addition to the high quality, devote time and effort in information technology, some medical service department in my hospital are also famous. For example, in rheumatology. Actually, our rheumatology team are accredited by the Asia Pacific League of Association called the Centers of Excellence. The diabetes team get awarded by the International Diabetes Federation, IDF, as the Excellence Center in Diabetes Care as well as in diabetes education. That's the only one in Taiwan. So WHO now are busy to combat the COVID-19 pandemic. But still, they recognize that promoting the digital health to enhance the standard of the people living globally are quite critical. That's one of the major purposes we are here today. In addition, WHO advocates that by using digital health, we can attain sustainable the goal we reach. In addition, the US FDA, they have a lot of statement and advocate of the digital health actually cover a quite wide range of digital health. Many of you are experts. I don't want to spend time here, but nowadays the mobile devices, the structural and semi-structural EMR and EHR, all the telemedicine, telehealth, and then combined with the big data. Perhaps we speed up down to the dream of personalized medicine eventually. So during the pandemic, I believe people all over the world can appreciate and now understand the power and necessity of using telemedicine or e-consultations in Taiwan area and all over the world. So what we have done and achieved in Taichung Veteran General Hospital, that's the reason we created as the Smart Hospital. Last year, we got 6 symbols from the outpatient service to inpatient service, surgical care to administration services, and then emergency care and pharmacy services. To get this national symbol, we have to pass the examination and on-site visit by a task team down to the hospital, commissioned by the Joint National Commission Taiwan. So I'll briefly touch these 6 symbols we got award. So the first one is the outpatient service. I believe many hospitals and clinics in Taiwan they have some kind of similar smart outpatient services. So the patient can make an appointment, they can cancel the appointment, inform the appointment, or remind the patient all the clinic or examinations. We also provide a smart, easy payment system so the patient can reduce their waiting time and easy to pay their bill. We developed our stand kiosk, which I will give the credit to our IT persons. Most of them developed this kind of systems, so they have the display of all the drugs information. So patient can check the medication they took or medication they will take and understand the drug interactions. They can also understand from the information desk about their locations or the outpatient service. They can even hook into this stand to link to the centralized the hospital or the health passport issued by the national health insurance systems. As many hospitals here, we developed the APP provides free service to our patients and families, and they can book, they can register, make an appointment, they get all the educations. And then if patient just want to know the laboratory test result after getting some application, they can come to the APP to realize and get the data of laboratories, which can reduce unnecessary visit. I actually got many appreciation from the patient and family too. Here's our smart inpatient service. We developed so-called patient informational terminal. And then by using this terminal, the medical care can easily communicate with the patient and the family about the diagnosis and the disease progressions. We developed our own the electronic dashboard, which in the nursing station, and displays many functions, including the professional who in charge the care team, the equipment location. And I believe many hospitals develop this kind of service too. And one of the example I would like to show you is the AI, which is implemented as one of our strategy in the whole department of the hospitals. So by using, collecting more than 100,000 inpatient data, after using the machine learning, we developed so-called early warning system in all our inpatient. It's a scoring system. The higher the score, indicate the patient might get worse in the next 48 hours. So this kind of system actually changed the behavior of our medical teams. And by implementation of the system, we are collecting the information in the hope to show that we can reduce unanticipated or unexpected cardiac arrest or shock in our inpatients. I believe it's one of very unique AI system, and the data coming from our own. Here is our smart emergency care process. Involve many calling system, repeat the checklist, and then PDCA improvement. So it reduces the so-called door to needle time of acute shock patients, reduce the door to balloon time for those acute myocardial infarctions. And here is our surgical smart process improvement. We develop a transparency, quality dynamic, the control board, so all the team can on the same line. By using this dynamic dashboard system, we have shown greatly reduce the cancellation of the operation and increase the surgical volume as well as the surgical services. And here is our smart pharmacy services. So by using this medication integrated system, they help the communication between the physician and the pharmacist. So we are shown that by using the integrated team, the duplication of unnecessary use drugs actually greatly reduce in the past 3 or 4 years. And we have published this result in the International Journal of Medical Informatics last year. If you're interested, you're welcome to look at the detail. In the recent 3 years, we developed the whole hospital glucose monitor dynamic system. So we integrate the glucose system into our vital signs and the figure transformation and send a message to our care team, indicate that the patient they take care will be have too high glucose or too low glucose. So by using this system, we have beautifully shown that the proportion of so-called hyper or hypoglycemia, poor glycemic control, actually reduced by using these dynamic on-site systems. So in addition to the inpatient, we also develop our outpatient diabetes system. So transform from those digital number into those figure patterns, which can easily to show, educate our patient family in the hope to get better diabetes controls. And this system also linked easily to the image of the diabetes retinopathies. And recently, we have collaborated with a company called Advanced Tech to provide continued care of all our patients from inpatient and then discharged to the outpatient, continue service in their home, and then provide those purchase online for their necessary good in the hope to provide the continued comprehensive diabetes care. And we also joined the Taiwan Precision Medicine Initiative, initiated by Academic Sinica. So in the hope we can get 1 million the genetic profile from the GWAS chip and combine with the EMR and EHR, provide the so-called precision medicines. So ladies and gentlemen, we are together with the Taiwan medical community to develop and jump into the digital health in the hope to provide a better care for diabetes and all our patients. Thank you for your attention.
Thank you, Dr. Wayne, for your presentation. Then I want to welcome Dr. Ro from Zhonghua Telecom, who will be speaking on industry connection and value innovation in the 5G smart health era. Let's welcome Dr. Ro.
Thank you. Ladies and gentlemen, good afternoon. My background is different from the first speaker. I come from the Zhonghua Telecom. Zhonghua Telecom is a telecom leading company in Taiwan. We have 4 core business. The first one, as you know, mobile service. We have about 11 million subscribers in Taiwan. So penetration rate about 37%. The second one is a broadband service. And the third, we have internet service. And the last is a MOD. So there are 4 core business. I still service in the telecom laboratory over 32 years. But last year, my boss added my new job. So I have 2 jobs. Currently I work in the telecom business group in Taipei. So why my boss asked me add a new job? Because for the past few years, our revenue declined very quickly. So he asked me our result of the research need to become to the money. So I in charge of the product of the department in Taiwan, in Zhonghua Telecom. Today, my topic is industry connection and value information innovation in the 5G smart health era. There are 3 part I will mention in here today. The first one, I will briefly introduce the smart health development. The second one is a 5G status application. The last one, I share our preliminary appearance of the healthcare with us. As we know, according to the UN report, the aging people already exit the children. From the low, this chart, the yellow line stands for the aging people. This dark line stands for the children. So 2020, the aging people exit. The number of aging people is exit the children. What we needed to face in the problem. WHO predict we lack the 20% medical power. So I think how we can use the new technology, for example, 5G, IoT, and the AI, to increase the working efficiency and to release the loading of the medical staff. So the smart health industry maybe include the three parts. The first part, I mentioned the physiological measurement device, which is a sensor. We can get the data from the human body. And the second part is a system of platform. The platform, the major duty is collect the data very easy and store the data and analyze the data. And the last is a service delivery. This is a profession service. This is a customization service. For example, dietitian can give you dietary advice. So if it depends on what's your health result, and they can give you advice. So smart health industry maybe will connect from the device, platform, and the service. 5G is coming. We still prepare launch 5G. I think 5G has three requirements. The first requirement is a standard. So in the past few years, we joined the national organized or standard organization like the 3GPP or NGMM. The second, if you finish the 3G standard, then the vendor can make the equipment. So the equipment needed to ready. The last is a bandwidth, a spectrum. So this year we won the largest bandwidth in Taiwan. We have about 90 megahertz in the 3.5 gigahertz. So we prepare, we launch the 5G in the July. In this stage, we only set up about 4,000 base stations in Taiwan. So the coverage may be in the urban area. Here we list some 5G technology that I want to explain more detail. But you know, 5G have a high speed or latency. So I just want 1.1. How can we do the low latency? There is a cap. What is a cap? Cap is a control and the user plane separation. So the control is a signal. Signal is handled by core network. But data we can handle by edge computing. So we can provide a low latency service in the 5G. Here we list the three features of 5G. High speed, low latency, and mass connection. The high speed the 5G speed may be provided over the 1 gigabit per second. This is a rational value, but in real case, you don't want to expect over the 1 gigabit per second, maybe the 100 megabit per second. So this kind of high-speed feature can provide immersive image experience, like the AR, VR, hologram, this kind of service. Low latency compared to LTE 4G. LTE 4G, the delay time about over 20 milliseconds. Low latency in the 5G about 1 millisecond. So we can provide the cooperator service, like the machine tool. You need to adjustment in the remote site, but you can guide from the home site because the senior people in the home site, the junior people in the remote site, you can guide what you can do and finish this work. So I think a cooperation in the low latency may be very suitable. The last is a mass connection. Mass connection, according to the standard, maybe 1 square meter where can be accommodated over the 1 million connection. So this kind of service may be suitable for utility, like the smart meter, water meter, gas meter, and the power meter, this kind. However, currently the standard over finished in the high speed, the enhanced mobile broadband. Maybe end of this year, low latency and mass connection will finish. Because we spent a huge money to won the spectrum, but we don't know what kind of the key application of 5G. So we need a plan the 5G. This is a vertical application for enterprise. So smart health is one of our plan. So we have planned another like the smart railway, connected car, smart meter, smart shipping, smart manufacture, smart parking, and smart inspection. But consumer application, not my obligation. So I just list the vertical for enterprise. Here we show the smart health ecosystem. Like the IoT, they are separated or divided into the 3 parts. This is a device layer. So the second is the platform. Chunghwa Telecom maybe can play this role. So we can provide only connectivity. But from the business opportunity, this only just 5%. So if we want to make a bigger business opportunity, we should be to do 2 things. One thing is we should be build up our platform which can connect between the device and the service system. The second, we will focus some of service. So in later we will describe, we have a data platform in here, and we focus on occupational medicine. So Chunghwa Telecom currently have some resource like connectivity, cloud storage. So we will prepare enter smart health from the platform and occupational medicine. So this is our plan. We plan in the 2 fields. One is a smart medical health care field, and another is a preventive health field. So here we list the 5 items. The star we stand for we have launched service. So we have two products. One is we call health cloud service, another enterprise health care system. So here in the button here is a personal a health cloud service. Based on this service, we can provide personal enterprise and medical health organizer and home all the value-added service. So in the later we will describe in here and another enterprise. This is a personal health cloud service. As we know, we can take our health or body data from anywhere, like a wearable device. We can measure it from the mobile and store this data on the mobile. And also we can measurement at home or public health center or hospital, or you can make the health examination. But all the data distributed in everywhere. So we have idea. We can file all the data according to the personal. So here we file this data according to the personal and follow HL7, and we use the blockchain to control their security. So this data can share our family, like the parents or son, or doctor or nurse, or pharmacist, or occupational health and safety staff. They can know your health condition. So this is our idea. So currently we have this system can connect multiple measurement, like the Omron, FORA. We can collect 7 types of vitamin, like glucose, blood pressure, blood oxygen. And after we collect this kind of the data, then we can analyze it or risk assessment. So here we can, according to your result of analysis, we can give you a comment. We can give you some video. You can watch the video, and you can take the how to take care of your health knowledge. So we can combine this information distributed from the MOD or the handset or the personal computer. Here we already connection to 5 hospitals and more than 30 clinics, and currently about 95,000 users and 55 companies join this system. The second one is enterprise healthcare measurement. Why we need to deploy this kind of the system? Because we needed to meet the 4 major risk plan. The 4 major risk plan is our government law. So this is like the overwork prevention and maternal protection or workplace violence. So every year maybe our government will inspection in the labor, in the factory. So he needed this tool to easy to meet the government law. Currently, we have two types of service. One is on-premise, other is a cloud service. So here, our customers we listed here. The low part, we joined the government project. We'll finish this project end of next month. There are 3 key performance index. We needed to join the 2 or more hospitals. 30 companies will join this system, and over 10,000 employees will use this system. So maybe next month we will finish this. This is a 5G plan. So just in short, I just mentioned we plan to telemedicine, telecare, and emergency ambulance. This is a case we about 2 weeks ago. I went to the Yuanrong Yiyuan in the Jianghua. The scenario is the nursing wear the smart glass, which we cooperated with Zhuozhen. Then they can transmit the high density video to the back end, so the doctor can guide how to handle this patient. So this is in the future we have a plan to cooperation with some nursing institution or care institution. The conclusion is the 5G AI IoT technology can increase our working efficiency to release the working load. At Zhonghua Telecom have already developed the personal health record system. We expect cooperation with our partner, like the hospital, care institution, or device company. That's my expression. So this is all my presentation. Thank you for your attention.
Thank you, Dr. Rowe, for your presentation. Next, I would like to welcome Dr. Ted from Guangda Computer, who will be speaking on contactless precision healthcare against COVID-19 through AIoT. Let's welcome Dr. Ted.
Okay. Good afternoon, ladies and gentlemen. It's both my honor and special privilege to be here and to share our thoughts about how we can do from ICT industry, against COVID-19. It's very difficult to present anything, after all these great speakers. But I will focus on how we can support and how we can help from ICT in collaboration with medical sectors. So. Many years ago, about 20 years ago, I asked Michael Dutuzos, who was the director of Lab of Science, MIT, one question: what is smart? Because it's very difficult to define smart, and he said, in his definition, smart means doing more by doing less. So one of the things that we are trying to do is that we're trying to, bring in more the intelligence, more the systems. However, we want to keep everybody, simple and easier, and also the whole system should be affordable. So I don't want to show you any complicated things, the products. I want to show you some concepts as a computer company in this sector. And so before I start, I would like to introduce our company. The company is called Quanta Computer. It's not so famous. It was a company founded back in year 1988. And in year 2012, in London Olympics, when I received the interview, he said, this guy's company is the biggest laptop maker on this planet. But we are more than just a laptop maker. The company is making, over 1 million laptops every 10 days. And every 1 hour laptop is made by Quanta, but we are doing many more things to support the world IT industry. So you can see that, when Apple came to us with a sketch, we make it into a computer. When there is a new operating system from Google, we make it into a Chromebook. When there is a new idea about the new watch, then we make wearable happen. And about 15 years ago, we started to work with MIT on the autonomous car. And also that Quanta is also the biggest supplier for cloud service providers and the cloud servers. And when, the world move into 5G, the biggest impact of 5G is they cloudify the central office. So we move into the 5G, directory. And also when the cloud service providers, they need the more powerful GPU server to do the, AI training, smart healthcare, and then we simply, make things happen. So Quanta is also the biggest and most important GPU server provider in the world. The last, little icon, the little bird, we call it is a Jabo. If you recall that 2 years ago, everybody is very interested in hunting, the Pokemon on the street. It's augmented reality applications. So we developed, real-time pushing systems to help people to locate the monsters. And so within 1 month, we have over 1 million downloads. And so we use the same technology to help the hospital push the real informations at large scale. So the company is very, powerful and making all kind of ideas happen. But we are also very good at deploy the product and service and solution at large scale. And scale stands for big things. Because, it's very easy for you to do a remote, healthcare for only the thousands of people. But think about this, for a city of over the 15 million populations, according to the definition, you should have over 2 million, aged people at home. So how can you build up a system to support the remote healthcare for them? And that's another thing to consider. So it's not an issue about just remote healthcare just to demonstrate something. It's about how you to build up a new platform to enable end-to-end smart healthcare, service over the cloud and to the end users at home. And talking about our research history, I'm the CTO. I'm actually the first CTO, and also I'm in charge of Quanta Research Institute. And together with a new business unit called BU12, dedicated to e-healthcare and also precision medicine. So with this business unit, it's very easy and for me to bring the ideas from the lab to the market. So starting from year 2005, we work with MIT CSL Computer Science and Artificial Laboratory, and we created a project called Tea Party, and basically we are very focused on human-centric computing. So we do smart healthcare starting from that, from year 2005. And in 2010, we moved the focus to cloud computing. So the name is changed to Cumulus. Cumulus stands for cloud with rains. And also water stands for money. So we try to convert the cloud computing into real business value. And last year we initiated another new project with CSL. So this project is very special. We are very focused on computational healthcare, which means that we try to use big data analytics together with machine learning to create a new healthcare model and to support the global, problems. And basically, this time is a little bit different because for the past 20 years, we only focus on the computer science side. We work with the PhD directly. But in our new projects, we work with PhD. We also work with MD. And we will also work with the hospital, all together in the order to verify and validate all our research results directly. So this is a project that we kicked off, last year. And it's another 5 years of collaboration with MIT. So Quanta is a Fortune 500, companies for years, but we also are very focused on innovations. So we, in 2 years, we were selected as, 100 global innovators. And back to the things that I'm trying to explain, I think the most important things that we try to do is that I think every human body is the source of big data. I think the many doctors has explained the details. So the most important thing is that whether we can get the data out of the body and in their daily life. When you collect the data, then you have to aggregate the data cloud. And inside the cloud, because you have big data, then you have to consider how to do machine learning, label the data, train the data, and come up with an algorithm. And wish that such algorithm can support you to have more precise, the therapy or diagnosis result either to prevent or to predict, what will happen in the future. So basically, this, view graph shows, the things that we are working. Thing is that, to do that, to do continuously, healthcare, you need a very special, low-power, connected device. That is first thing. So device is the first thing. Second, if you want to collect all the data, you have to find a powerful, scalable, cloud structure to aggregate all the data you want to have. And then, the cloud computing has to be high performance because sometimes you have to do training and inferencing inside the cloud. And also, if you want to do inferencing inside the device, then you have to do edge computing. So again, it's all related to data. And the real value of human to data is actually algorithm. And the way, you pass your human intelligence to the data is through labeling. The major label works inside IoT platform or AI platform is actually the labels. How to label the data in the right way that captures, all the doctor's intelligence in the systems so that you can come up with an algorithm. So for example, if the device is an ECG, then you have to come up with an algorithm related to ECG that can help the doctors to provide a much precise, decision. And so this is, ABCD is simply our, strategy for the future, and that's what we are doing. And so you can see that, in every scenario of artificial intelligence of things, we are not just trying to collect the data, we try to provision artificial intelligence as a value and through the networking and to the hospital, to the patients, and for social cares. So everything they create, the massive data, the machine, big data, and you also have, user behavior, activity, environments. You keep all data in the cloud. But, sometimes in a hospital, for the past, many years, they also have their human-based algorithm. How the human-based algorithm can work with the machine-based, algorithm together, and to achieve precision healthcare. That is another thing to consider. But you can see that that's the directions that we are heading to. So many years ago, we developed systems that integrated, client devices, the different kind of connectivity strategies, and also cloud, and to link to the, caregivers. And so we piloted this in Canada and to help the, aged peoples, and we also piloted these systems to the patients. I think my microphone might be out of battery. But I think I can finish it very, very soon, if you don't mind. Yeah. Could I? So basically, patients in different area in the world, they are facing different problems. I mean, the problems people are facing in Netherlands, the problems people are facing in Canada and also Nordic area, totally, difference. I mean, in Nordic area, they are very focused on loneliness, mental care, not physical care. That's another things to consider. I only have 3 minutes left, so I have to speed up. And so you can see that if you want to enable this, to support the medical care, to the home, then you have more devices coming in. You have AI, VR, AR, VR, you have 5G, you have client, you have cloud AI inside the cloud, in order to provision the care, to the final care to the patients, it relies on many different kind of collaborations among, computer company, medical device company, and hospital all together. And based on the time-critical issues, sometimes you have to put the final neural networks at the edge device. So you don't need to, go to the hospital directly. It can give you the, direct warning, and that's another challenge. That's an edge AI at the device challenge. And so we build up something, but in addition, Quanta is also the biggest companies doing AR and VR for your informations. So we build different kind of imaging systems, and we create a system, a platform called Quokka. And we try to help the hospital and also the caregivers globally to enable their smart healthcare services. And this is only some video clips, and for you to understand the scenario might change. If a patient go to the clinic and basically you can take a small stethoscope, you can measure it directly by your hand. But what if you are in these situations? Then everything needs to be wirelessly transmitted to the APP, right? And if you are separated, you are isolated, the patients in a ward, and how can you continuously provide the care? And if the patient is stay at home, how can you do that? And also, if you have AI, and that will make things different. So we are not just trying to track, the patient's location. We try to understand at his location what kind of service we can provide him, and also what is his current status by sensing and monitoring, technology. But we try to simplify all this technology at affordable level. Imagine if there is over 1 million patients, how can they support such new systems? So that's something that we are trying to do, and we are trying to help. And so for us, it's very difficult for us to predict the future, and the best way to predict the future is simply to invent it. Thank you.
Thank you, Dr. Ted, for your presentation. Ladies and gentlemen, this comes to an end for the presentation session. Later, we'll start panel discussions in 3 to 5 minutes. For setting, please stay online. We will start again shortly. To begin on panel discussion session. For this part, the moderator belongs to Dr. Wang. Let's welcome our host, Dr. Wang.
Okay, I believe you already all enjoyed the talk from our speakers. So right now is a very unique opportunity for all the participants here or online to listen to our panel discussion, and also later on you can raise up your question. We can answer to ask this industrial leader. So the first question the society give me, okay? So because I have listened to you of all the possibility of the 5G, so all the possibilities you have mentioned. So I'd like to ask you a very quick question. So what field do you think that will be a breakthrough of the 5G? Because there are so many possibilities, so many applications, but what do you think? What is the first place? What is the breakthrough point
when you can really apply the 5G in the healthcare. Okay, Dr. Yang. So we have like 20 minutes, 20 to 25 minutes. So we have 3 questions. So probably we will need to go through all the questions quickly. Okay.
In my opinion, I think 5G plus AR or MR is applied in the operation room. This is a very, very quick breakthrough. I think it's very, very quick, successful platform. Yeah.
So do you think the VR or MR will be very popular in tomorrow's OR?
I think because there is some software can integrate into the AR, and then there is some very, very unique technique. Therefore, they can isolate your location and localize the. There's some software they can merge from the CT or MRI data into the software, and then you can see through that. You can locate the tumor and the real world MR data. I think this is very popular for surgeon to operate it. Now there is some application in the orthopedic surgery, in spine surgery now, but in the future I think this is very very useful for operation. Thank you.
Okay, thank you. Okay, Professor Xu.
Yes, I believe there are many areas when 5G could be used in medical community, but I would suggest that upgrade the technology and build up infrastructure will be the key to innovation and then applications.
So infrastructure. So we need to build up the 5G infrastructure. For
not only
hospital.
software, but also hardware and those transmissions. It's
So
still behind so far here.
For tomorrow's hospital. Okay. So how about you, Dr. Chen?
In my opinion, I think the most important breakthrough is about infrastructure. And as I mentioned in my slides, the chance of 5G in hospital is it enables us to build a private 5G network in hospital. And this is very important because in hospital we have security and the privacy issues. So if like 4G, we can build things like that. So with private network, we can do a lot of works. But and also in hospital, I think, yes, it's really in surgical area because I'm also a surgeon, so I think the 5G applications might have a lot of chance. For example, we are writing right now. We are trying to use remote consultation within OR, or even in our neurosurgery. Neurosurgeons, they can use the augmented reality glasses to see through some of the tumors behind the brain lesions, the brain structures. So they can use the AR glasses to explain his operation plan to patients. That's what we are doing right now.
Okay, thank you. So we're going to listen to opinion from 2 industrial leaders. Okay, so Chunghwa Telecom has a very ambitious roadmap. So what do you think?
Yeah, I think 5G have 3 features, as I mentioned before: high transmission rate, low latency, and mass connection. I think most challenge is coverage. I think 5G not exists standalone. It should be combined with 4G. So in the initial stage, I think only a hotspot or urban area just only provide 5G. So if we want to provide a new application or innovation application like the telesurgery or telescale or telemedicine, it should be challenges coverage. So I think maybe Chunghwa Telecom needed to spend most effort to do this. Maybe it can be satisfied our subscriber.
I mean the data transmission.
Yes.
Okay.
Yeah.
Data transmission. Yeah. Okay. How about you, Dr. Zhang?
I think I totally agree with everybody. So one of the things that I can possibly add is that I think any applications that involve with high bandwidth and real time, and also require high privacy, might be, good for 5G applications. But also 5G applications, they have some limitations. And so that's something to consider because it's very, very, the frequency is very high. And I would say that, many people right now think that, surgery applications means AR, MR is one of the biggest applications right now. But the infrastructure is also very important because if you want to, transmit such a, high, the bandwidth inside the hospital, then sometimes the architectures might need to do some, modification as well. And also there are many applications at the edge server inside the hospital will be something to consider in the future. Yeah, thank you.
Okay, anyway, the bandwidth and the speed. But we still very interested to know where is the breakthrough point because there are so many possibilities. Okay, so let's go to the next question. So next question is about AI. So okay, so there is some disruption of the wave, the hype of the AI in Taiwan because the past 2 years, Taiwan's government put almost all the technology budgets on the AI. So people talk about AI in healthcare. So so what do you think? The same question. So what do you think? What is the breakthrough point of the AI use in healthcare? What do you think?
I very agree with the Dr. Chen's presentation. I think AI should be applied with other technology, for example, AIoT. But I think this is a multiple supply chain to get together. For example, the company developed the AIoT sensors, but you can use the data scientist to AI training, but which part you will apply in the field? So this you should combine with the service in the hospital. I think this is very important. This is a collaboration with each field. So AI alone is not the issue. I think how to cooperate with each other is the issue.
Okay, so about 2 weeks ago, FDA just approved a company, the brain image. So you are a neurosurgeon, right? Brain image. So use the AI to analyze all the CT scan or MRI. So, but they give them the approval of the so-called assisted screening. So that can reduce the workload of the radiologist. But they cannot replace the expertise of the radiologist, but they can assist. Okay, so the use of AI in image seems one direction. So how about?
Actually, there are many difficulties and barriers which we try to solve. I would suggest that the number one should be mindset. I mean, mindset is among the medical society as well as the information technology. Enhance the dialogue. We have dialogue many times before, but given the equip of all the IoT, AI on hand, we should enhance and encourage the dialogue between the two groups. Actually, the gap is coming narrow now, but still, we wish that we have many dialogue and ignite many good fire and then continue improvement. And most critically, I believe all the action, all the AI, the final purpose is provide benefit either to patient, to family, increase efficiency, reduce the cost. So never forget that all the action we take is finally we want to see the outcome. That's the goal we are putting.
Okay, Dr. Chen.
About AI, I think, and nowadays everybody's doing claims that they are doing AI, but in healthcare, we didn't do a lot AI applications because we choose the AI topic in healthcare very seriously. And because we need to first find the value, how we should do that, and how people our physician will accept that. For example, a lot of hospitals they are working on AI for ECG diagnosis. And we are doing that, right? We are also doing that, but we choose different directions. We are only focused on life-threatening diseases that with specific AI findings. That's our value, and we don't want to build an AI system to diagnose the ECG to compete with physicians. We just want to make a reminder system to remind them if they have no time to interpret the ECG result, and we can help them. Yeah.
Okay. Father Lo.
I think AI needed two requirements. One is the data, another is the algorithm. They put it together, they become to AI. So they like the funnel and the engine. So I think that the maybe three-level difference. The first, we can correct the raw data become to useful information. I think just show the dashboard what condition you have. This is level one. The second level, I think we can use this data and the algorithm and predict in the future. Then the same as the traffic information, we collect the signal from the handset and we predict in future or near future or long-term future what time will traffic congestion. The third level, I think, not only predict, and they can guide you. How can do that? So if you have data like from the hospital, you can predict your health in the future. Like people like me, if you have 20 years old, maybe I can predict the 40 years how health you have. Then I can guide you how promotion or preventive your disease. So I can use the huge data, I can do different levels. So maybe many different the value-added services using this tool can create.
Okay, Mr. Chan.
I only have the experience as patients. I don't have experience as doctors. But my humble opinion is that I think medicine and health is a little bit different. I mean, when you get sick, you go to the hospital, you take some measurement, and the doctors, based on this kind of measurement or readings, they try to develop diagnosis and develop some kind of therapy for you. But health is a little bit different because we are talking about very long-term monitoring. And so because we have long-term monitoring with many different kind of data, including your activity and environmental data, which means that the patients will have more information about your norm because every people are different, every person are different. And with such norm, you understand the deviations, you understand when this kind of people get sick, they go to the hospital, you understand precisely what you should do. But such data are very diverse, and also it's huge. And so that's called big data. It's a data of very long history. And so with this kind of data, only the machine can read, can learn. And so that's the reason why you need artificial intelligence, you need powerful GPU server for that. And so that's another direction. Another thing to consider is that, I mean, from year 2012, when ImageNet, they actually bring the AI back to the industry, and everybody focus on imaging. But now is not the time to recognize which is cat or which is tiger inside the picture. It's about how to recognize which cat will evolve into a tiger or which tiger gonna dead. And so that's called prediction. But it also needs more data. You need not just the imaging data. You also need the hospital information, records, and so that you can make different judgment, and that makes the AI more useful, in the future, and many people are working in that direction as well, working with many different type of data all together for training, And I would say that that stands for one of the future possibility on a smart healthcare. Yeah.
So with so many application for the IT technology in the healthcare field, so were you concerned about any humanity or ethical issues? Because the security issue, I think this is not the topic of the day. I think so we will need to worry about the security of all the IT information. So how about the humanity, and how about the ethical issue? So from the industry perspective, have you ever thought about any perspective from the humanity or ethical side of the use of the IT technology in healthcare, please?
Yeah,
比较难，这题比较有点
I can give you example for traffic information. You know, we collect traffic information. Usually, we use the vehicle detector, which is a device very underground. When the vehicle pass by, when the vehicle pass by, we can get information from the coil. So that's not much too enough in the local. So we collect from the handset. So this is a relative the personal information. So the first step we did identification. Then we use this data to influence the how traffic performance in the road. So this apply to the healthcare. Maybe we can need to more need to protect the information. So as I mentioned before, we developed the personal record, health record. We use the blockchain who retrieve the data, or we browse the data. We have all the record. We can preventive the hack through into the data store. So this is very important for us.
Okay.
I think this is a very good question, a very difficult question as well. I think the most important database that Taiwan has is the data in the national healthcare insurance, and that's the biggest database actually in the world, and very important. So there are two things. One is that can we use this kind of data to create a new AI model and to further enhance our level of healthcare in Taiwan. That is one thing. The second thing is that how you avoid, the privacy. So it's very important to the screening out the data, the personal information, the IDs, and make it clean enough to support the research. However, it's also very important to bring the research outcome back to the original, hospital to provide, personalized, the medical care, and that's a big challenge for everybody. And so we just talk about autonomous car, and also you have to think about the responsibility when autonomous car has some accident. Who is responsible for that? And another thing is that some technology, basically, it's not encrypted. For example, if you want to understand whether there is an elder, the fall on the floor, and you use camera, and camera is not encrypted. But if you are using a radar or other technology, that will be different. And so some people started to consider things like this because of GDPR from Europe. And that's something to consider. And we are still at the very beginning to think about this, but this is very important to create better healthcare, but not to have any conflicts with humanity. And so that's a big subject. Yeah.
Okay, Dr. Chen.
That's a tough question, but I think when we're doing AI or big data applications, we will encounter some problems like that. And there is always some technical solution for that. As I mentioned in my PowerPoint, we do federated AI learning using federated learning mechanisms. So actually, we didn't have to share our patients' data, and we can still train in the AI modules. This is one way to do that. But but that's right now it's some special cases, and when we're doing AI project or big data project, we still need to think about how to protect those privacy data. Even those data are already de-identified. Those data cannot be lost, and must be used appropriate method to protect.
Yeah, there's consensus in the medical community that whatever how smart of the machine AI, they never replace the care and temperature to the patients. So when we in the medical hospital teach the young physicians, that we tell them that you have to listen to the word of the patient, but you have to understand the word patient did not say. That's one of the care and warmth for the patient. So in addition to the private thing we discussed, I just want to mention that even the available or many IoT, they are still underserved populations. They never use elderly, low socio-economic. They are lacking of the cellular phone. They don't know how to use the app. We still have to provide easy, cheap, and convenience tool for those underserved population when we develop our AI.
Okay, Dr. Yang.
In my opinion, the balance between technology and humanity, if the issue is concerned about the privacy of patient, you should get a permission from the patient. This is the limitation. If you develop the technology, so this is very important to mention about that, because you should tell the patient how's the benefit and how's the damage may be. So this is very important. So all of our study in my institute, all the study were developed between the technology. We under the control of IRB. So everything we should, if the issue is associated with the patient's privacy, you should get a permission. If this is not associated with the privacy, I think you can develop to any field. But the most important thing is no harm to the patient, especially the privacy. Thank you.
Okay, so thank you to all speakers. So we have a few minutes, so we can open up the questions to the audience on site and also from remote. Okay. Okay, so 他有没有指定谁? No. Okay. So there are two questions from online. So first is Taiwan is helping. How to do? How about use a blockchain, third-party payment? Have you ever thought about using the blockchain technology for the payment for the healthcare in the healthcare? Anybody can answer this question?
We are just working on that area and still not realize in a blockchain to all the payment systems.
You mean not realize?
No.
Yeah.
Not
so can you explain a little bit?
Well, that's one of the secret encrypt area that have a very good protection of the transfer. And someone predict that area not only for the payment system, but all the private and big data information protections. But we are just in the beginning only, so we don't have much experience in that area.
Do you think, sir, you see the future of the blockchain?
Yes, I would believe
use of blockchain
area,
technology.
That area would be in combination with the AI and the big data would be the trend that the medical community should consider.
Okay.
I would like to change a little bit about this, the questions, how blockchain can help healthcare, and basically, I'm not just talking about financial data. I'm not talking about trading. Basically, is using blockchain to exchange a piece of information. So basically, people actually they're using blockchain for data exchange, and that is one thing to secure the data exchange. And of course, when there is no hierarchical financial systems, people are thinking to use blockchain to do that. But another thing to consider is that blockchain will also create an overhead of the transaction. So there are many debates using that, but I can see some the applications that if everyone has their own data and they want to trade the data, and using different kind of systems, then people will think about using blockchain to do that. Yeah.
Okay.
Okay, I think it is very difficult to answer, but maybe this is a business model. Business model who launch this kind of solution, who take the benefit, maybe can, for example, maybe can cooperate with the insurance company. Maybe insurance company like you buy this the product, just like if you take an airplane, maybe the delay. So if the delay, you can use the blockchain, that no relight, no can avoid. So maybe the insurance company maybe can direct pay you. So maybe this is a new business model, not in the technical issue. So just I just can say only.
Okay, so since everybody is interested in using the blockchain for the payment, okay, the insurance company can use this technology to reimburse the patients directly. Okay, so the second question, actually there are two parts of second question, but I think the first part we have gone through this part. So the first part of the second question is that what does 5G actually mean for the healthcare industry? So I think that we have already discussed this. So the second part of this second question, so how about the response to COVID-19 of 5G? So you have any idea? So what is the application of the 5G to cope with COVID-19?
Yeah, recently I joined the CDC executive Zen. So somebody maybe will identify he want to stay in the home. So we have a we have a telecom company. If that people can take the handset, so we can discrete area. You just on this area you can move, but then not go to outside. So we can collect the signal from the handset and identify. So the people go to outside or inside. So this can help our CDC department to prevent the virus to spread. So another we cooperation with the Cheng Kung University. This is a wearable device. He can take the temperature, body temperature. We send this data from the AI system. According to they set up the model, they can predict the people when will have a fever. So this is applied to the CDC. So Chunghwa Telecom have joined these two projects in CDC.
Okay, so let me summarize your points. So firstly is the tracking of the quarantine people, and the second one is wireless transmission of data. Yeah, okay, very good point. Thank you.
One thing I can think of about COVID-19 in hospital using wireless technology, but not limited to 5G, maybe use Bluetooth or Wi-Fi technology, is right now we can using cell phone to know who near you at a specific time, right? And the same idea in hospital, we can deploy many sensors in some of the medical equipment, for example, X-ray machines or some machine there, people sometimes maybe have to share. So if some patient we found he is a COVID-19 cases, and then we can tracking the machine and the record to find out who is contact with him and what's the equipment the other people use. Yeah.
Okay, so tracking the location of the not only the people but also the equipment. Yeah. So any other solution? No? Professor Xu? Okay. So Jaime, any other question? Okay.
Thank
Please.
you all the speakers for sharing their...
So this will be the last question. Okay.
I'm very interested about for your presentation. This is one slide. It's very, very useful for the patient. There's one slide that you so-called the early warning system. And regarding the last speaker, you were also talking about for algorithm. So I'm just very interested. I am curious about for from the Taichung VGH, what is the algorithm for the early warning system, and that's where can be, especially for inpatient, and that can prevent from the inpatient bedside to ICU. So you also mentioned about for prevention for cardiac arrest, sorry, CA. Yeah. So would you mind to share the more algorithm regarding for early warning system, and that will be very valuable for us. Thank you.
Yeah, a brief answer is actually there are formulation of early warning system graphs the predict items, several predict items actually being used in other countries. But this one actually we correct those items and put into the machine learning, they develop an algorithm by a couple of predictors, most of the vital sign, oxygenation, saturation, and such on. So each patient, when they come to the hospital, those data was measured and automatically transferred to our IT person and then his system. So that number can be calculated and continue changes. So when the number higher means the patient might get worse. That's what I mean. Many IT products, but the most critical part is if the IT product could change our behavior and then translate into the good outcome. And we believe that one we use currently is very good for the inpatients.
So I believe you already have the publication, right?
Submit out.
Submit already. Okay.
So one of our developers is our IT person,
okay.
Huang Jianzhong.
Let me closing up this session because right now the early warning system is already become standard in Taiwan's hospital accreditation. You can witness that next year because we have put that in our standards. So every medical center, big medical center, they need to establish some kind of the early warning system to prevent the INCA, unplanned INCA, intra-hospital cardiac arrest. 好，那我们现在是已经是评鉴的标基准 ，so become standard. So Taiwan standard is very high because of hospital accreditation. Okay, okay. So let me closing up this session and hope everybody enjoy. Thank you.
Thank you all the speakers for sharing their valuable experience and knowledge through their industry.